Well, is this the picture of government-run health care? Republicans releasing this flow chart today, which they say exposes the bureaucratic mess that's going to come with it. This is actually a flow chart on this whole deal, how this whole health care works out. The guy behind that chart joins you right now. He's a fan of, obviously, the Monopoly board game. Texas Congressman Kevin Brady. He's a member of the House Ways and Means Committee. Congressman, I'd love for people at home to see this full screen, and Pammy, if we can do that. Take a look at this, and is there a way to zoom in on this if you can't? It is a mess. And the connection between the patient and the doctor and the labyrinth of agencies and various federal oversight boards between them is staggering. How is this supposed to be helpful?
Well, it isn't. I mean, what patient in the right mind would choose to put that much government between them and their doctor? And at the end of the day, the result of that chart, because people just want to know, how's this all going to work? And the result of the chart is, the government's going to make decisions on what doctors you see, what treatments you deserve, and what medicines you get. And that's not what Americans want.
All right, now, I took a look at this chart in a little bit of detail earlier, and a lot of Democrats countered that what you were doing is vastly complicating this and saying that it wasn't nearly this labyrinth of agencies and oversight committees that you purported. What do you say?
It mirrors the bill exactly. Our staff went provision by provision, identified every new program and mandate. There's 31 new programs, agencies, and mandates. They replaced some, we deducted them. So we actually simplified the chart a bit because their bill is
this is simplified?
And the chart reflects it.
All right, well, here's what interested me. It's hard to look at this, and I apologize to those at home. It's a mess because it's a mess. It's not our fault, not your fault. You have the private insurers tucked in with traditional health insurance plans, then this low-income subsidy group, then the Center for Quality Improvement, and these health affordability credits, and the agency or group supervising that. So you have a lot of people, a lot of groups writing off on your care under this system, right?
You do, and in fact, if you look at the bottom center of the chart, it's really the key, that Health Choices Commission, that's right. The health czar. You know, a lot of the government decisions are going to be
now that dude's expensive. I'm sorry, Congressman, you're an encyclopedia at this. I'm just learning the ropes, but I want to show that because that big blue box in the middle, that's where all the enchiladas here. You really shouldn't overdo the enchiladas if you're looking at healthcare, but you got my message. This HCA commissioner is the uber czar here, calling all the shots, right?
It is, and that's the person that when they do the comparativeness, effectiveness, rationing, regulations, all that, that's the person who picks winners and losers in the healthcare system, and the patients who are the losers, they're in trouble.
Well, let me ask you, Congressman, we had your Democratic counterpart from New York, Congressman Weiner, on, who was saying, but this is hardly a joy what we've got now. We've got complication now. We've got overlapping now. That this is a better alternative than what we have now. What say you?
Look, government red tape and government intervention in Medicaid and Medicare has made it one of the most costly and I think most ineffective healthcare systems around. They're just expanding that to the private plans that most of us are very pleased with. It's complex because this bill is a mess. It won't lower quality, it won't increase quality, doesn't lower costs, we lose control. It's a problem.
All right, Congressman, I'm going to take Boardwalk for $50. Seriously, sir, thank you very much. Man, oh man, what a mess.
You bet. Thank you, Neil.
All right, well, take this czar and shove it. I want you to meet the guy leading the charge in Congress to cut off all cash to all the president's